Welcome. Come with me. The doctors will see you now.
Welcome back to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
I'm Dr. Veer Vidala.
So today on the podcast, we're joined by Dr. Sharon Smallwood, a family doctor practicing in the ER with the Cherokee Nation. She's also a civil surgeon working with the PIC Med Clinic, helping patients navigate the immigration physical process. She's also involved in training and preparing the next generation of physicians through the Youth Medical Mentorship Program. So from emergency care to mentorship to immigration services, she's redefining what it means to be a family physician. And we're delighted to have her on the podcast to discuss her truly unique practices and the way she serves her community. Dr. Smallwood, thank you for being here with us.
Thank you.
Thank you for having me.
So the PIC or the PIC Med Clinic, I don't know how to pronounce that, does immigration physicals. What does that involve?
Well, for those that are looking to become citizens or looking for their green card, they have to go through a pretty rigorous process. Process starts with you obtaining a lawyer, an immigration lawyer. And along the way, you have to have a physical because you have to be certified as not having communicable diseases or other medical or behavioral issues that might prevent you from appropriately assimilating into the country or prevent you from having like the best health that you can have, right? Mm-hmm. So you make contact with our clinic. We set you up for an initial appointment. And at that appointment, we will look at your immunization records, your vaccination records, all of the records that you may have from either your home country or from this country. Anyway, and we compare that to the checklist that the federal government has put out for items that you need to have. So for vaccinations that you need to have, we'll take a look. We'll let you know which ones are deficient. We'll give you the ones that you have, and then we set you up for the physical exam, and that's where I come in. Okay. So the parts that occur before you get to me, I am reviewing. I'm reviewing all of your vaccination records. Okay, this is what you need. This is what you don't need. This is how many in the series. Start the series. Go from there. I have a really good team that works with me, by the way, because awesome. That is a lot to keep up with. But on the day of the physical exam, it's much like any other standard head-to-toe physical, right? You're looking at eyes, ears, nose, you're doing abdominal exams. You're not necessarily always having to do an invasive exam. So we're not having to always do a PAP or pelvic or genital visualization or anything like that unless there is a problem.
Okay.
And then we will do that. For the most part, all of the exams I've done have been on people who have lived in the country longer than I have. Yeah. So they've already had, some of them have had babies. Yeah. They've had surgeries. So they've had full exams. We sit down and talk to them just about their behavioral health as well. Do you have stress? Do you abuse any drugs? Do you drink alcohol? Do you think it's too much? Has anyone ever told you that it wasn't enough? Mm-hmm. And so we focus on that to make sure if there is a problem, we identify it, and then we get the patients the help that they need, regardless of whatever it is, right? So typically, the most common things I might find might be high blood pressure.
Yeah.
Some of them had not been to a doctor. Some go to a doctor and they're already on meds. I can certify them with that. Mm-hmm. But for those that don't have the resources we're able to put in their hands, these are the clinics that will see you cash pay without insurance that might speak your native language, all of the above.
Okay.
And as one of the only females in the state that do that, it's important for a lot of the cultures to have a female physician.
Yeah, absolutely.
And you must be a physician.
Yeah, that's so cool.
Yes.
So to do this, do you have to, like, what is the title of civil surgeon? Is there like a process to like get certified for this? And that's you go through that process and you get certified, then you're able to do these physicals?
Yes, it's actually quite easy. Right,
okay.
You had to have, I believe, 5 years out of residency or training. And then you make the application with the Department of Homeland Security and then the U.S. Customs and Immigration Services. I always get the acronyms, just all the letters mixed up sometimes. Yeah. And once you've made that application with them, they then will assign you a civil surgeon number, and then you're able to begin completing the exams, doing the immigration physicals, certifying, and signing off.
Okay.
So that people are ready to go to the next step in the immigration process or the citizenship process.
So are you like a government employee?
Well, I'm not an employee.
Okay,
Ooh,
okay.
Thank God, no.
No. Okay, sorry.
It's
Not
like a
not
contract,
right.
It's like a contract,
Just
okay.
contract. Yes.
Okay.
And
That's
I'm not
fascinating.
paid by them. I'm paid by the patients that come through. But I am contracted with them to make sure that I am, when I certify someone as being fit and sound and physically able, that is the truth. And that we have worked up everything that we need to work up with them. All of their information is placed into a sealed envelope. That envelope must remain sealed until it gets to the authorities.
Yeah.
So does the government have a specific form they expect you to use for
They
that
do.
physical process?
They do. It's called the form, I believe it's I-93.
It's going to be alphabet and numbers.
It
in for
is.
sure.
It
It's a
is.
form, yeah.
There's no telling. There's a couple of them. So yes, you fill out the form. But for the physical, they don't give you like a set physical exam form. So we just use the forms that are in the office that we made based on what they're looking
What they're
for.
looking for, sure, sure. And then sometimes people are coming to this country in a refugee status and may have left their country due to conflict and other things like that. So they may, I'm guessing, may not have immunization records necessarily readily available. So is there a standard set of if you don't have proof, even if you think you got it, you just get whatever? So
Well, if it's needed, sometimes we can draw titers.
Okay.
And if your
Okay.
titers are within the acceptable range, then you don't have to have
okay.
any other
Yeah.
testing done.
How long do these visits usually last?
Well, I can get them done probably in about 20 minutes if there is no problem.
Yeah.
If there is
no
a problem, then it may take longer.
Yeah.
I mean, but typically 20, 30 minutes max.
Yeah.
You can get those visits done because a lot of the work is loaded up front. So if I'm going to walk into an issue, I already know what their blood pressure is.
Yeah.
If they have protein in their urine, then I'm ready to work that up. If there's blood in the urine, let me go back and look at some of these records and try and figure out,
Yeah.
what's going on with it.
Do you have to order labs, like something?
Yes.
That they're okay.
Yes. Order the labs and everything from the clinic.
And so patients do them first, and then they come to you.
Yes.
Or- Okay.
Yes.
Wow.
So once they make that initial contact, hey, here's what I have so far. Look over all of that information, checklist. We've got this, this, and this. Okay, grab a urine. Oh, they were exposed already to TB. Then we just need a chest X-ray, and here are the questions that go with that.
Yeah.
Versus, drawing the blood or doing it. We don't do the PPDs anymore. So
Right. Right.
Yeah.
Just a blood test.
blood testing.
Quantiferon.
Yep.
Oh, wow.
Yeah.
So I may have misunderstood something. So if you could clarify a little bit, I had understood you make a comment earlier if someone came in that had high blood pressure but has seen a doctor, is on treatment for that, and that's someone that's easy for you to certify. But if someone comes in, never seen a doc, has uncontrolled hypertension, is there a requirement for conditions to have some degree of management before they can go through
There is.
the rest of the immigration process? So it goes beyond just looking for infectious diseases.
It does. It does. It is managing their health and making sure that as close to optimal that you can get it, the better off you are. So for a patient that might come in and their blood pressure is elevated, we will wait and take it. And we may even have them come back
Sure.
in a couple of days. Let's take it again in a couple of days.
Yeah.
Team is good with that. If it is still elevated, then we have a form that we give them that tells them, hey, your we might address it, dear provider, if they don't have a doctor, dear practitioner. I've seen so-and-so for an immigration physical, the blood pressure was high. Here are the readings that we got.
Sure.
Can you please see them, work up a plan, send us back that plan. Let me know, including medications if you start any. And that will be enough to kind of get them onto the next step.
Gotcha.
Okay.
It's kind of similar to people like truck drivers coming in to see their primary care, but they have to get like a physical done.
Yes,
be able
DOT
to-
physicals,
DOT
that type.
physicals,
I used to do those too.
Oh, okay.
Like a jackass of all trades. Let me tell you. Used to do those too. And so learned so much,
Yeah,
I've learned so much about how the world works. And even though, I didn't do occupational medicine
Right.
as a career choice,
Right.
I still do occupational medicine
Right.
as part of my career.
Yeah.
So
Fascinating.
it's good. It is very interesting. And it's, we have translators available or they'll bring translators with them. But it is so good when I walk out of the room and they're like, okay, what else do we do now? I'm like, that's it. That's it. If you'll give us 6 days to put your packet together, we'll get it together, we'll seal it, we'll call you, you can come pick it up. They are so relieved because it is such a long process.
Yeah, it's like nerve-wracking.
And if something happens and it is a year later, you have to repeat the physical again.
Okay.
The physical is only valid for a year. So I've had a couple of repeats. I've been able to find, in addition to blood pressure, I think I had one woman who had a uterine tumor that was humongous. And I was like, is your belly always this big? And, we kind of went through the whole thing. And she's like, no, not really. I think I've diagnosed one, had a syphilis diagnosis on someone who had no idea. Wow. And this was before, we really kind of had the resurgence of the syphilis.
Yeah. Okay.
So it's good stuff. It's good.
Yeah. So it sounds like you have an opportunity, even though you're not in a position to have ongoing continuity of care with these patients, to really have a big impact, both for preventive care as well as public health.
Yes, absolutely. And we, there are only a certain number of clinics that you can send people to anyway that will accept cash, or like OU's Bedlam Clinic. So when they see typically a letter coming from PicMed, they know, okay, we're going to work with them to try and get them in because they need the help.
Yeah.
Right.
Yeah.
What other free, like OU Bedlam Clinic in the Tulsa area, right? Are there other free clinics in Tulsa area you refer to?
Yes. There are quite a few on our east side. And then OSU has a clinic that we can refer patients to. And then a while back, they had some other smaller urgent cares that would allow people to come in and be treated for blood pressure. But I don't think they have those anymore.
Okay. Fascinating. Well, listeners and viewers, thanks for joining us. We're going to take a break and put a pin in it right here, but we'll be back for another episode with Dr. Smallwood, talking about more of her practice episodes. So until the next time, this has been Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.